the majority of the country, I think people think, okay, the pandemic is over, and yet people that work in the post acute space and in skilled nursing facilities in general, or specifically, they know that it's not, and they will continue to deal with COVID. They will continue to deal with other infections, especially as they're going into the winter. What are some simple tips that you can recommend for some of these facilities, for these administrators, directors of nursing?
Yeah, so we are not. So I did 2 webinars yesterday, national webinars, and, we pointed out, like, we show the transmission rate in our country, and it's like 90% substantial to high spread. So folks who's ever listening, like, we are still battling this battle. Now, fortunately, we have vaccinations. Fortunately, we have boosters that are helping reduce the severity of the illness, which is really great. But anytime a nursing home has an outbreak, they're still wearing N95 respirators. They're still wearing the PPE. I mean, this is such a burden and fatigue. I can't even tell you the fatigue. So this is really contributing to the burnout and the staff turnover. And so we need to really be compassionate and understanding. As visitors going into nursing homes, the majority of the outbreaks are coming from visitors coming in. We're
Oh,
not allowed to test them. We're not allowed to even make sure they're vaccinated. And so the majority of our outbreaks are coming from our visitors. So if you're visiting a nursing home, please test yourself before you come in, or, it just will help the nursing home so much to prevent them from constantly being in this outbreak, because that affects other residents that have to go on isolation. It affects the staff. And ultimately, number 100%, like we're saying, it's visitors coming in and it's staff coming in too. But we're testing our staff twice a week still.
mm.
Every single staff member is being tested twice a week. So we really need that partnership from our visitors to do their part and to test and to help us not bring COVID into our vulnerable populations.